If people don't like you, that doesn't mean you're unlikable. The person gets a negative experience, then they personalise that and they think, well, that means I'm unlikable. No, you just didn't click with that person.
Dr Mark Rackley,
a psychologist,
helping you cope with major mental health issues.
What is the cost of repressed emotion?
It's terrible. That essentially will poison your body. But if repressed emotion is held in the brain, then the brain has to do something with that energy. What you'll find is it will come out in the physical symptoms. So the person might be struggling with, say, migraines or dermatological problems, or very common one is guts. They have emotion trapped in the body, which is actually causing problems.
Out of all the traits of ADHD, what do you think the three ones are that, if unmanaged, can cause the most problems?
So the emotional dysregulation, and
is there a way us ADHDers, can we control our overthinking?
Yes.
This episode is dedicated to anyone who overshares at parties, but then stays up all night worrying that everyone thought they were too much. I know you've probably heard this a million times on other podcasts, but following or subscribing really helps the show. And the more followers we get, the more likely it is that I'm able to book new, exciting, and insightful guests for the show. So, if you subscribe, I will continue to keep to my word and promise to never let this podcast be sponsored by Huel. Dr. Mark, thank you so much for joining us.
Thank you for having me, Alex. It's an absolute pleasure.
Let's jump straight in. If a new patient were to come into your surgery, where would you begin to start unpicking if they had ADHD and what effect it might be having on their lives that they don't even know about?
Oh, it's a very big question. To break it down, some of my patients would be coming in already with a diagnosis. So they've come through either via a psychiatrist that specialises in ADHD. So I've already got the diagnosis in front of me. So I know exactly what I'm working with. With others, when I get a new patient, I'll do a full assessment with them. So we go into their childhood history, we go into what's going on now, and we kind of try and draw a picture of their life, but also to draw a picture of their life, their mental health life. And when you're talking to them in terms of what's happening now, you're listening, okay, well, is there some depression or some anxiety? But you're also listening as well to, is there anything developmental here that might be kind of underpinning what I'm seeing? So if I'm hearing a story of difficulty at school, problems with dealing with their lives, kind of constantly having kind of chaotic moments, challenges at home and relationships, or challenges with kind of organizing their life, then I'm listening to that, and I think when you work with ADHD, you kind of have spidey senses, I often call them, where you're kind of like, oh, I think that might be something. And you kind of just dig a bit deeper. And if it's a young person, I always have the parents or a parent in the room. So I'll often say to the parent, like, well, can you tell me a bit more about that? And the parent will tell you everything. Like, you'll get a whole load of history. And if you're still seeing similar patterns kind of running through the life of the person, and the pattern is still live by the time they come in to see me, Alex, then you're pretty kind of sure, all right, I think I know what this is. And then you'll gently present to the patient, I think we might have undiagnosed ADHD here. But I'll only ever say that if I'm 95% sure that what I'm hearing and what the patient's life story is telling me is giving me those markers that this is a story that's running along with their life.
One thing I've noticed with people with ADHD is that they can be filled with shame.
Yeah.
And that quite often can stop them wanting to share their inadequacies with their parents or their peers. So what is the cost of repressed emotion?
Oh, it's terrible. It's a simple answer to that. Repressed emotion, that essentially will poison your body, because emotion is not meant to be repressed, it's meant to be processed. And by processing it, then it works through the brain, it works through the body. It doesn't get held in the body. But if repressed emotion is held in the brain, then the brain has to do something with that energy. So it compromises how the brain works. But then it has to go somewhere within the body. So what you'll find is it will come out in the physical symptoms. So the person might be struggling with, say, migraines or dermatological problems, or very common one is gut, hits the gut. And it's not got an organic source. So the person doesn't have a bug. They have emotion trapped in the body, which is actually causing problems. The tricky thing with shame, and shame is a very common emotion when you come, like you said, when it comes to dealing with ADHD. Shame is awful because shame is all-encompassing negative emotion. It's how the person sees themselves. So there's chronic feelings of worthlessness, not feeling good enough, not feeling that they're worthwhile. And unfortunately, like shame can lead to people feeling suicidal because they just get so hopeless. But also, if they're dealing with all that repressed emotion, then the narrative in shame is, I'm not worth listening to, nobody's interested, I'll be judged, I won't be treated kindly. And because you've got the rejection sensitivity anyway in ADHD, if you've got somebody who has shame with the rejection sensitivity, then it's a massive thing for them to then say, hey, I'm not doing so well here. So it's, for somebody with ADHD with shame, I know certainly for me, I tread really carefully with those patients, really, really carefully, because you don't want them to in any way be triggered or feel a sense of, he's not listening to me. Yeah. So you've got to be almost like, you've got to hold them really gently and just reassure them you're safe here. Because of course, the primary feeling that they have, Alex, is this isn't safe. And so, like all of us, if something doesn't feel safe, then we back away to protect ourselves.
You mentioned RSD there, rejection sensitivity.
Yeah.
What's happening in our brains when we experience RSD?
So RSD, again, in the ADHD sphere, it's a chronic sense of feeling different, and that the difference is negative. So therefore, then what you expect, or your prediction is, I'm going to be treated badly here. The person is going to reject me. So with RSD, the person wants to protect themselves from the rejection, so they overcompensate. And when they overcompensate, then that can go lots of different ways, where they are very careful what they say and what they do, or they'll be the opposite, where they'll be the Jack the lad. They'll be the person to make everybody love them, so that there's no sense of them being rejected. But essentially, what you have there is it's linked to the shame. It's an overactive sense of, I'm different, the difference is negative, and I don't want to experience either shame or rejection from my peers or my family. So therefore, then it plays out then in those interpersonal relationships. Yeah.
I mean, it echoes a lot what I hear from my community, and that's that the reaction to shame, the reaction to rejection can be so intense, it actually stops them from leaving the house sometimes. Yeah. They're so scared of encountering a rejection, they don't put themselves forward for that promotion. Or even as extreme as they won't go to the shop in case they say something to someone, because it can really throw them off course for the whole day. It's that visceral, it's that intense.
Yeah.
Is there a difference between how men and women deal with feeling inadequate through the school years?
Yeah, there is actually. That's a very good question. So, by the way, I'm generalizing here. So obviously, there's variables and individual difference. So anything I'm about to say, if for the listeners, it's like, that's not me. I totally get that. That might not be your story. So I am kind of going on more what the research tells us and how we kind of understand kind of more general populations as opposed to individuals. So yes, what you tend to see with boys is the the boys will more externalize. So you'll see that in the behavioral problems. So boys tend to be a bit more disruptive. They can be talk back more. They can be more difficult in terms of what they're saying and doing in the school. And for girls, you might see it more internalized, where you're not necessarily going to see the behavioral problems that you get with the boys, but the girl will internalize it more. So that might come out in anxiety, where they become quite anxious, but the anxiety is linked to their ADHD, but that's how it manifests itself in a symptom. So there are differences there, yes, in terms of how girls and boys deal with school. Yeah.
The emotional dysregulation, how can that manifest itself in someone who's undiagnosed?
Yeah, I had this conversation today. Interesting, in my clinic. So, if you think about emotional be careful with the mic here. I use my hands a lot. Your body will naturally sit in a place it's called homeostasis. So homeostasis is where it's a place where everything's just working perfectly. So your heartbeat's fine, your blood pressure's fine, everything's just kind of sitting really, really nicely. And ideally what the brain wants to do is keep the body in a homeostatic state. So even with the emotional surges, it will always want to pull you back here, which is why we can't stay in an emotional state all the time. We'll always drop because the body will bring it back to the homeostatic state. So what you get in the emotional dysregulation with ADHD is it can go either way. And it can seem quite strange in terms of how that manifests itself. So for some of my patients with ADHD, it would be the big meltdowns. So massive overreactions. If you look at the context and how the person is then reacting emotionally, it's completely larger than what you imagine it is. So that kind of dysregulation, which is a massive overreaction, and the person struggling to bring things back down. It can go the other way as well, where the person doesn't show that kind of outburst, where they internalize it. So with some of my patients, what they do is they disconnect. So they shut down. So they go very quiet. And they're not saying how they're feeling, because again, the dysregulation, how they feel safe in regulating the dysregulation, is to just contain it all or repress it, like what you said. But what you also get with the emotional dysregulation, Alex, is it goes not just negative but positive. So it can be where if the person is enjoying themselves and it's super fun, then they take it to the next level. So when it goes to that and the person's having a really good time, they can emotionally dysregulate in a positive way as well, which would be that's the person that the party never stops. They're the last person to leave a night out. They want to keep the party going because they don't want the feeling to stop. And that's another form of emotional dysregulation too. So there's no cutoff. And the cutoff only happens when the person sort of is, the night's over or they're wrecked. And then it drops. So it goes both ways, actually, yeah. And it's interesting when I'm listening to my patients, and like, they don't often think that they can see that as a positive, that piece of, well, I'm having a good time. But if we kind of like, well, like, when would it end? And of course, in the mind of an ADHD patient, it just doesn't end. It just keeps going, yeah.
With the emotional dysregulation, I suppose having an awareness of oneself is the first step, but are there ways to manage your emotional dysregulation?
Yes. So the one of the key parts is the understanding, but also understanding the environments that maybe trigger you. So I know certainly for lots of my adolescent patients, we do huge amounts of work around school, and even down to the specifics of teachers. So some teachers are wonderful, and some teachers are the petrol on the flames. There's a personality clash. So learning the triggers, learning the areas where you're more likely to dysregulate, but also big parts of the work I do is listening to themselves. So noticing the changes. Now, obviously, it can happen quite rapidly, but noticing the changes if they're starting to dysregulate. So that's being aware of their heartbeat, being aware of their breathing. If they're noticing they're losing focus quite quickly, or they're becoming kind of heated, then it's listening to the physiological signs to show actually something's happening here. So using their body as a cue to help them identify what's happening. And then once we kind of do all that work, then we look at, okay, what do we do to intervene? And certainly with my young people in school, that might be where, again, we put all these things in place where the young person, they get 5 minutes out of the room, they breathe, they calm down. Some of my patients, we have them, they're allowed to wear their headphones. So they go out, piece of music on that we know works, gets them calm again, and then they go back in.
What do you think the most common triggers are for emotional dysregulation?
I suppose anecdotally, Alex, I think a lot of the triggers are interpersonal. So with the rejection sensitivity, and again, I'm generalizing here because you have to generalize with ADHD, and again, caveats, this doesn't land with people, but a real kind of sensitivity to injustice and wrongdoing and being on the receiving end of wrongdoing, that can be a huge trigger point for people. I think the other piece as well is not being listened to. So feeling like this person isn't listening to me. And then that feeling of I'm being treated differently or being treated badly. And so the other thing as well is if there's any, it's heartbreaking, but if there's any kind of bullying that's happening in school, or if there's any kind of bullying that's happening in, say, the workplace, then of course they're massive triggers as well. Yeah.
A girl with undiagnosed ADHD, what might her struggles be in pre-pubescence versus adolescence and then young adulthood?
So with an adolescent brain is a brain in development, regardless of whether it has ADHD or not. It's maturing and it's growing. Now, what we know about an ADHD brain is it matures at the same rate as any other brain. However, part of the brain that's responsible for executive functioning, your prefrontal cortex, develops slower. And we're looking roughly at a 3-year gap in terms of the development of the prefrontal cortex, which of course is why people with ADHD can struggle with executive functioning and management during the teenagers. So some of the struggles that you might see with a girl in particular, she may struggle with the thing like disorganization. She may struggle with being able to plan and manage her life. She might also struggle with interpersonal relationships because, again, if you've got the rejection sensitivity, at that stage of life, you're moving from kind of childhood to adulthood. So you're creating your own independent identity, and the family become less important. Your friends become way more important. So there can be a lot of issues around the friendship groups and integrating into the friendship groups, feeling understood and feeling accepted by the friendship group. So you can see that those kind of issues. Now, you wouldn't necessarily see it as an adult patient because, of course, an adult patient has now, they've got an adult brain, and also we tend to care less, not everybody, but we can tend to care less about popularity when we're kind of adults. But when you're a teenager, it's massive. It's absolutely massive. And also it's being accepted. That's a massive thing. And that's, by the way, that's a non-ADHD and an ADHD thing. It's just the group becomes all important, and being accepted by the group is vital. What you can also sometimes see with girls as well is they can sometimes struggle with perfectionism. So it's the compensating for the struggles that ADHD can cause. So you can see kind of fear of failure. They become very obsessed about doing the academics perfectly, but also that can create identity issues too, where it can lead to body image issues if they feel that their body isn't the way that other people think it should be. But again, you don't tend to see that so much. I mean, you can do, but certainly in more adult females, you tend to see less of the interpersonal problems and maybe more to do with managing their professions, managing the stress of their jobs, managing the stress of life, dating, all that kind of stuff. So different challenges, but still you'll see the ADHD at play there.
And if we looked at boys, are there any differences in that transitional period?
Yeah, there are. So with boys, again, because the group becomes hugely important, boys can do terrible things to try and get the group to like them. So again, that more kind of behavioural stuff that they might be doing things they really shouldn't be doing, or their ability to think consequentially is a problem. So you can see a lot of behavioural difficulties with boys. What you can also see with boys as well is, again, they can get very competitive. So they can become quite fixated on, if they're in team sports, being the best, because again, they don't want to experience any kind of rejection or feeling different. And you can see the opposite with boys as well, where it's very sad. They can actually develop other disorders. Girls can too, but they can have things like depression as teenagers because they're just hugely struggling with coping with their life. Or they can have very bad anxiety because they struggle with academic performance, a family expectation, and managing their life, especially if they're in a high-performing school. Yeah.
Do you think it's beneficial for somebody who is displaying ADHD characteristics to get a diagnosis of ADHD?
Definitely. I can't say that strongly enough. Yeah. I understand it's personal, and I understand there's loads of things around getting this done because the waiting lists are horrendous. I get that in CAMS, and the waiting lists privately are horrendous too. But how I see it, Alex, is it gives you a framework to understand what's happening to this person. And that framework is hugely helpful in terms of just the understanding that it brings with it. That your brain is wired differently. This is why we're seeing your life happen like this. This is why these. So it gives us the causality. And I think that that's hugely important, because without that, then the person can really feel misunderstood and they can feel, well, what's wrong with me? But when we explain, listen, like you've got and I sometimes don't even use the diagnosis of ADHD when I'm talking to my patients. And I think in the future we won't. I think, psychology, psychiatry, it's constantly evolving. We're constantly understanding and learning. So, things that we talked about years ago, we don't talk about anymore because they're redundant. And I think in the future, that's the road we're going down. So I just label it as neurodiversity. And I think even in the future, we won't even use that word. So neurodiverse being your brain's a bit different and it's wired a bit different. And because you have a different brain, these are the things that we know can happen in your brain because of the way it's wired. And so it just normalizes it, but it also, it allows the person to understand and hopefully start on that road to acceptance of, oh yeah, this is okay. And it just brings down what you hope anyway, is it brings down that sense of, well, I'm different, but them thinking that difference is a negative.
Aside from acceptance, you must see a range of emotions and reactions after someone gets a diagnosis later in life. What are some of the reactions that you see?
The main one's anger. Yeah, I see a lot of anger. So anger is a massive one. And it's understandable because this might be a patient who's they've gone through uni and they've had a battle through uni. They've battled to get into their career. They're still battling, things are still problematic. And when you do the history, the thing about ADHD is it doesn't just appear at some random point in your life. From what we know about it, you're born with it. This is with you from the get-go. And the anger is justified because it's well, why did nobody pick this up? And the patient in question may have seen the school nurses, been in front of the GP multiple times. There might have even been child psychologists or whatever involved, and it wasn't diagnosed or it wasn't picked up. And so when you I'm always very gentle when I say this because I know kind of how it goes down. I think there might be some ADHD here, and I'll say why. And then we send them off for assessment, and then the assessment comes back, yeah. Then we start the whole treatment plan for them. And it's anger. It's anger, yeah. Because, and sadness as well, that, well, it could have been different for me, or I could have had less of a challenging life. So in some cases, when you're dealing with an adult patient who's diagnosed later in life, you have to help them process all that anger. And you have to also help them process all that sadness, because lots of their memories, their core memories at those stages in their life when, in an ideal world, it'd be full of happy memories that you can reflect on, they're really negative. And if we look back, it's ADHD. Yeah.
A lot of sadness and anger looking back at the life that could have been.
Yeah.
Really the life that should have been if they had just known sooner. You know, perhaps that relationship would have lasted. Perhaps they wouldn't have left that job.
I wouldn't have got fired. Yeah. Oh, totally.
Maybe they wouldn't have got into that relationship.
Yeah,
if they had just
absolutely.
known.
Yeah.
Do you think there's an evolutionary advantage as to why us ADHDers overthink?
Yes and no. So overthinking is, you got to be careful about overthinking because you got to use it wisely. So with overthinking, if you overthink about everything, then essentially that's a precursor to anxiety, and possibly excessive worry and panic. So you got to be careful with that. But where I think the overthinking can be a positive, Alex, is that it can help you to see the world differently, or think through different scenarios, or work with a problem in a more holistic way. And I think that's where it can be a huge advantage, because again, without sounding too generalist, but like lots of my ADHD patients, their creative mind is insane. Like the stuff they talk to me about, or the things that they're thinking about doing, like it's amazing, because it's a whole different way of seeing the world. And so I think certainly in terms of like just creating different things, or art or culture and all of these things, even in business and working with people, then absolutely, yeah. But I often say to my ADHD, like with any of these kind of superpowers that you have, you gotta use them wisely, because if you don't, they can bite you. Yeah.
This is interesting. Do you think there's a benefit to overthinking that no longer exists in the modern world? And actually that might suggest that overthinking is actually just the hangover of human nature?
Yeah, we tend to associate overthinking with, because obviously we're born with the ability to think, and overthinking is a way for us to really analyze something, or when something important. So it is a huge gift. But I think where we're at with overthinking now is, unfortunately, we're overthinking about the wrong things. Like people are overthinking about why hasn't that person texted me back? And why aren't my followers on social media growing? And why hasn't that person, why have they left me unread? So it's all of that stuff. And that's just not healthy. It really isn't healthy, because that doesn't kind of bring humanity along. It just generates anxiety. So I think there's a big part to that, which is influenced by where we're at currently in life. But also I think like technology and just the way we relate to the world is very different now, which is not healthy for overthinking. Yeah.
Is there a way us ADHDers, can we control our overthinking?
Yes. Probably not control, but manage. Yeah. So I always say to my patient, right, if you're overthinking, then look at the context in terms of what am I overthinking about? So is this about a scenario where I am being influenced by my rejection sensitivity? So whether replaying a scenario where there's been a party or a social interaction, and now in the aftermath, they're replaying it. But what they're doing there is they're just adding stories that don't exist, which of course inevitably generates the anxiety and the worry. So I always try and help my patients get the context, like look at the story of what's in the overthinking. And if it's something where you're predicting or you're overanalyzing without evidence, so we don't have any evidence to suggest, listen, this needs extra thought, then we do a piece of containment. And the piece of containment is, right, I know what I'm doing. I know this is going to bring me down a rabbit hole if I stay with this. So I'm going to use a distraction technique. And that's the beauty of ADHD, because it naturally aligns itself to distraction. It's like, oh, look over here. And so we use a distraction technique, which we know will re-engage the brain and will pull it away from the overthinking. So that's where it's a real gift with people with ADHD, is it's easy to distract the brain away.
It's the classic story of the ADHD community. You go to a party, you overshare, and then you come back and you almost can't sleep because you're worried everyone thought you were too much. But then you look at the evidence and no one's texted you saying, why did you say that? You were outrageous last night. There's no evidence to back up the thought of being too much. Super interesting. On to sleep a tiny bit. When I'm trying to get to sleep, my brain feels like it suddenly needs to switch on. And I overthink like crazy. Mm-hmm. Do you have 3 tips that might help that brain unwind?
Yeah. So first of all, with ADHD, especially if you know that's, and again, I want to just kind of normalize that. So it's not a given. If you have ADHD, you're going to have problems with your sleep. Like lots of people with ADHD sleep perfectly. It's just certain types of people will, the lack of stimulation at nighttime, the quiet space. Unfortunately, the brain can wake up in that space looking for stimulation. So, but that's not everybody, but that's obviously what you might struggle with, Alex. And so if you know that, then it's really important to prepare that is a time in the evening where you might struggle with trying to wind down. So 3 things I would recommend is in the kind of hour before sleep, that you really try and create an environment where it's calm and you get off your devices. Yeah. So nothing that is going to remotely stimulate the brain. So you take all that away and you create a calm space. In your bedroom, then your bedroom should be a place where it's an environment where it relaxes you and it's not chaotic. So that being that the light is right, that your bed is comfortable, that you're looking forward to getting into your bed because that's a place of comfort, but also it's a place that you want to spend time in. And the third one would be white noise. So white noise doesn't stimulate the brain. It does the opposite. It relaxes it. So is any particular kind of white noise, like it could be static, crashing waves, wind through the trees, that you're creating noise in the environment. And where that can really benefit people with ADHD is the brain will obviously listen to the noise, but it won't stimulate the brain, but it gives the brain distraction, and that can help it sleep.
Oxytocin, that's the chemical that we release when we experience human connection?
Yes.
Does that help with sleep?
I don't know is the answer to that, because the main one with sleep is melatonin, which is your sleep hormone. It would help, I suppose, in terms of, because oxytocin, it's the bonding chemical. So it makes, like, if we need a hug and somebody gives us a hug, it's like, oh, that feels nice. So it does relax the nervous system, and it does make us calm down. So yeah, I would think on that scientific level, in terms of its effect in the body, that if you had a dump of oxytocin in the evening, be it somebody you're cuddling in bed, or even they've done studies on oxytocin where if you spend 20 minutes stroking a dog, then it increases the oxytocin levels in the human and the dog. So I'm not recommending pets in bedrooms or whatever, but if it helps, then absolutely, yeah. Yeah. I'm a big believer in kind of being creative with these things. Like, it's never one size fits all. And if you can get something that works for one particular patient, then great. Yeah.
What do you think are the biggest mistakes people are making in the lead up to bed?
Devices. Getting off the devices. Yeah.
Social media use.
Totally. Because that's what they're designed to do. They're designed to keep you on, and they're designed to keep you engaged. And so, and especially for people with ADHD, where the brain is constantly craving stimulation, it's looking for different, interesting things, then it's one of the worst things, Alex, to kind of help the brain to wind down. So I think the biggest one is devices. Yeah, for sure. And so, certainly with some of my patients, we're literally like, the devices are not to be in the bedroom. They can't even be in the room, let alone arm's reach, because it's too tempting. But also, what some people can do is they if they're struggling to sleep, they think, they'll pick up the phone. That's the worst thing you can do, literally, because that's not going to relax you. It's going to wake your brain up. So I would think at this stage, definitely devices, yeah.
I've spoken to people in the community, and they say sometimes they're quite tired. They go to bed, and as soon as their head hits the pillow, it gets filled with intrusive thoughts, and it's those that keep them awake.
Yeah.
What advice would you have for that type of person?
So intrusive thoughts are a normal thing. So we can't control intrusive thoughts because they come from your unconscious mind. And so we can't stop those. So the first thing is accepting that they're just a natural part it is to be conscious. But what can help with intrusive thoughts is mindfulness. So intrusive thoughts are exactly that. They come in, but they move. But where we can get stuck on intrusive thoughts, we pay attention to them. And when we pay attention to an intrusive thought, then the brain has no choice but to focus on it, because it thinks that this is important. And if we focus too much on intrusive thought, then the intrusive thought, instead of moving along, and the person's like, there's nothing to see here, let the next thought come along, the brain then starts to attend to the intrusive thought. And if we start building other thoughts and feelings around the intrusive thought, then it empowers it and it wakes the brain up. So first of all is understanding intrusive thoughts, understanding how they work. And then mindfulness is great for that, because mindfulness teaches you just to let your thoughts pass and to not give them attention, to not focus in on them, but to literally see them as thought process, as just brain processes. So the brain isn't always generating thoughts because you need to think about this. It's just doing what it does.
What are the most common types of intrusive thoughts?
I suppose the ones that I tend to deal with in my clinic would be more the serious side of intrusive thoughts, I suppose, around suicide, self-harming, hurting yourself. So those kinds of intrusive thoughts would be the ones, I suppose, they're probably the most serious, but they're the ones that I suppose can cause people real distress, because obviously they're not very nice things to be thinking of. But you can literally have intrusive thoughts about anything, yeah. So we can have intrusive thoughts about our friends, our family, our boss. So there can be any number of things, yeah.
And aside from essentially acknowledging them and depowering them, is there anything else someone could do to combat or manage intrusive thoughts?
Get professional help if you need it. Like if you're really struggling with them in terms of if they're becoming too frequent, if they're distressing you, then it might be a good idea to get some professional help with managing those intrusive thoughts. But I suppose the thing with an intrusive thought is what you don't want to take is a passive approach. Because if you take a passive approach, then like I was saying a minute ago, it's not necessarily going to move that through your mind. You need to do something active. So whether that be you talk to somebody else and that person knows about your intrusive thoughts and just help you to think about something else, or you do some mindfulness, or you use some distraction. But what's very important with intrusive thoughts is that just because we think something doesn't mean it's real. You know, where we can get into trouble with intrusive thoughts is we can start to believe that could happen. And then that can become a real problem.
What's an example of one that you think could happen?
the most serious ones where if I'm treating a patient and the intrusive thought is, I could throw myself in front of a train. Terrible thought. That's frightening to think like that, and it's scary to think like that. But that doesn't mean that the patient is going to throw themselves in front of a train or that they even want to do that. But because that intrusive thought lands in the conscious mind, then that can cause real distress for that person if they're not able to manage it. Yeah.
I want to do the washing machine of woes.
Great name.
Every week, I ask my Instagram community to share their ADHD woes with me, and I put it in a washing machine because for me, the washing machine represents my biggest woe, which is memory loss. I always forget my laundry in the machine. I'll say this every episode, it will stick. Do you forget your laundry in the machine ever?
I have done many times, Yeah.
Very reassuring to many people listening, I'm sure. Right, this week in the washing machine, I would like this to be read out anonymously.
Okay.
I'm 17 years old and I'm gay, but I can't come out because I'm so terrified of what my friends and family might think. I suffer from severe RSD, and even though I'm sure they will accept me, I'm terrified of them not accepting me. What can I do?
Oh. Okay. I think this person's already in a really positive place because it sounds like they've already accepted their sexuality, the fact that they're recognizing that they're gay. A big part of if this person can hold this. Unfortunately, what RSD does is it fills your mind with negative consequences and negative outcomes, and it gets stuck into details. It's all about what could go wrong and what would be negative outcomes for you. But it doesn't look at the bigger concepts that are at play as well. So what I would encourage this young person to do is think about, do they trust their family? Is there a high degree of trust within this family? Is there a high degree of love and kindness and respect within this family? And if the answer to those is yes, then that's safe. That's a safe space. What RSD will convince you of is this isn't safe. But just because it feels like it's not safe, that doesn't mean that it isn't safe, because what we're not focusing on is all the other evidence to tell us otherwise. So I would just think about the bigger picture of your family. And if there's enough there to you think, yes, this is all good, then maybe identify one person in the family. Like, I often think with these things, like, it's never one size fits all. Like, if there's one person in the family that you think, you know what, I think they're the safest person in the family to kind of just get the words out and to get somebody to support me, then identify that one person and then decide what you want to do next. So if you want to tell everybody, go for it. But have that person working alongside you so that you don't feel so alone in doing it as well.
Amazing advice. Thank you so much on behalf of the person.
Job.
Really useful. So thank you very much. We touched on perfectionism earlier. I wanted to explore that a tad more. A lot of us with ADHD, we are perfectionists, so much to the point that we don't even try to execute the idea out of fear that it might go wrong.
Yeah.
Why do you think that is?
Fear of failure. Yeah. It's fear of failure. So fear of failure is a very real thing in terms of, if you think just the problem with fear, we were talking about this earlier when we were talking about inside out. So we were talking about inside out earlier. That fear is one of the emotions that's hardwired. We're born with fear because it's essential for survival. And the problem with fear is it's very sensitive to being triggered. So it's triggered when we're in actual life and death situations because we need to take action to protect ourselves. But it can also get triggered when it's not life and death. There's no active threats. There's nothing awful happening. But we trigger it because of fear of consequence and wanting to avoid those consequences. So when fear gets triggered, we get three responses, which is fight, flight, or freeze. And with fear of failure, what you get is flight. So you get avoidance. And the avoidance is because the person doesn't want to potentially experience failure. So I see this all the time, unfortunately, Alex, that when it comes to taking exams, when it comes to the study, it's all avoidance. And this person isn't dropping out of school or that they don't care. They care too much. And they care so much they trigger fear that they're not going to achieve and they're going to fail. And then the fear then creates an avoidant response. Yeah. It's awful. It breaks my heart when I see this. And I see this sadly all the time.
Do you have any tips on how somebody might rein in their perfectionism?
Yeah. So first of all, perfect people don't exist. So you're holding yourself up to an ideal which is not realistic. And also the other thing as well, nobody expects that of you. And if people do expect that of you, then they really need to rethink, why am I putting all this pressure on this person? I think as well, it's important to identify everybody has different strengths and weaknesses. So nobody has all the gifts. So work with your strengths, work with your weaknesses, but don't try and have everything working at the same level because that's not realistic. I think the other thing too is being really mindful of perfectionism is not a positive thing. It puts too much pressure on you. It can and instead of it actually enhancing your abilities, it will do the opposite. It will actually curtail them. And in some cases, it will stop you from achieving what you want to achieve. So really kind of looking at it in perspective, because unfortunately, what can happen with perfectionism is it can be held up as a positive thing, and it's not.
People pleasing, that's a big topic as well. And I think there's a clear correlation between the people I speak to and people pleasing.
Yeah.
I think RSD can mean the thought of being rejected is overwhelming and therefore we want to please everyone. So do you have any tips on how to put up boundaries without offending people?
Yeah. So first of all, with that one, you're going to have to get used to the idea people aren't going to like you. That's just reality. Like, not everybody's going to gel with you. And if people don't like you, that doesn't mean you're unlikable. What can happen with the RSD is that if the person gets a negative experience where somebody maybe doesn't gel with them, then they personalize that and they think, well, that means I'm unlikable. No, you just didn't click with that person. So it's creating those healthy boundaries in terms of they're the natural boundaries within interpersonal relationships. But also there's this idea as well in psychology, we call it finding your tribe. So finding your tribe is like finding your people, and your people who you kind of really, they're your crew. They're your people that get you and you get them, and it's all kind of easy and nice. So it might take you a while to kind of find your tribe and to find the people that really get you. But if while you're on your way and navigating all of that, it's about understanding that just because, again, you feel that this person isn't maybe gelling with me, that doesn't mean then that you're being rejected or that other people won't connect with you.
For me, it's always been a source of attack on my self-esteem because I end up saying yes to everything because I'm so scared of letting someone down. Yeah. So you have no integrity. You have no self-respect. And as soon as you start putting those boundaries in place and you say yes, or you be more decisive on what tasks or what projects you say yes to and no to, you take back some of that control. What do you think some of the other costs are of being a people pleaser?
Oh, it's awful. Yeah, I mean, I know that can seem like, again, it can be positioned as a positive, but it's not. It's not. Because it's exhausting and it doesn't create healthy boundaries. So you might be saying yes to something that's right for everybody else, but it's wrong for you. So with people pleasing, again, it's understand, well, what am I doing here? Like when we get into people pleasing behaviors, we're basically losing agency because we're allowing the other people to dictate to us what we say yes and no to. And saying no is really important because saying no creates a healthy boundary that you can get to stand on the right side of, as opposed to saying yes to something that's maybe more dangerous for you. So I often say to my patients, it's very important to be assertive. And being assertive is being able to say no. And being able to say no and be okay with the no, because the no works for you. And if other people don't like the no, well, that's unfortunate, but that's not your problem, because you've not done something wrong here. But if other people don't respect your no or respect your boundary, then it doesn't mean that what you've done is wrong for you, but it might be wrong for other people. And that's okay, because the people who respect you and the people who understand what you're doing, they won't question that.
Are there any other ways someone with ADHD could get better at putting boundaries in place?
Yeah, so I think again, it's important to kind of understand how the ADHD is playing out in your own life. So if you're finding that you are kind of prone to people pleasing, that you're taking risks that you shouldn't be taking, that you're maybe making decisions based off of the more impulsive nature of ADHD, or if you're one of the things I talk to my patients about all the time, Alex, is if they're bored, like just the general state of being bored isn't great actually, because then they might go looking for stimulation, or say, if somebody say, hey, do you want to do this? Oh, well, I'm bored, so I'll say yes, when actually it's probably not the right thing to be doing. So again, it's understanding the context, but also it's understanding as well, if I'm not using the word no enough, then why am I not doing that? And then reasserting the no in a healthy place. But there needs to be that recognition that this isn't working for me. And so therefore then change needs to happen.
Out of all the traits of ADHD, what do you think the three ones are that, if unmanaged, uncontrolled, can cause the most problems in someone's life?
So the emotional dysregulation, the impulsivity control, and I want to pick the right one here. I'm thinking in my head around the ones I hear the most. It would be probably sleep. Yeah, because sleep is like, if your sleep is probably, they use sleep deprivation to torture people for a reason, because it just wrecks the person.
And starting really early, how do you think someone who feels inadequate at school, what effect can that have on that person later on in their life?
Again, it's tragic, because it can create a sense of not being good enough, low self-esteem, not feeling able to take risks. So it can have massive knock-on effect on their confidence. So they're less likely to apply for jobs they should be applying for, or to ask that person out on a date, or to go and do things that are going to be more challenging. So it can shrink their world, and instead of them exploring potential, it does the opposite. It can massively limit the opportunities that person can have.
We spoke previously, and you said some schools are really well versed in understanding, managing ADHD, and others aren't. The ones that aren't, what are they doing wrong? So
I could do a whole podcast on this and probably ruin my career. Name schools, by the way.
And go.
But I'm sure if some of them watch them, they'll know who I am. The problems with some schools is they don't want to put the work in to manage neurodiversity, because that takes resources, and it takes money, and it takes effort. So some schools will put that in, and they're amazing. They will absolutely have the best services available for young people with ADHD. And the teachers are well versed. Everybody's really up on what this young person needs. And so it's really tailored to ensure that that's a safe space, that's a supportive space, and that the young person feels very, very welcomed, but also they're able to thrive in that space. So some are brilliant with that, but others they don't want the naughty kids, because that's how these kids are labeled. because they're disruptive. They're the kids that hand in their homework late. They're late for school. Their uniforms, inevitably there's a piece of the uniform missing. Or they will talk over the teacher, or they'll interrupt. And so instead of understanding, okay, what is that? And like then that young person is they're seen as a problem. And then if the school is not interested in addressing that problem, or they don't want those kind of kids in the school because they're disrupting the experience for other people, or they bring bad PR to the school, then my experience is that those schools want to move those kids along.
What can teachers do to better equip themselves to spot undiagnosed ADHD or other neurodivergent conditions?
I think it really depends, Alex, on the services in the schools. So some of the schools have proper dedicated learning support centres. And in those learning support centres, you have the SENs, which is special needs assistants. But then you also have other members of staff that are really well versed and trained in neurodiversity. So those centres essentially are they're the place in the school that takes care of all of this stuff. So they disseminate all the information. They liaise with all the teachers. They're amazing with the parents. They liaise with me. So I have direct contact with these particular services within school. I mean, it's amazing what they do. And so what you get is just a really brilliant space that works, and it really works. It works. I've seen this multiple times. It works very, very well. But if you don't have that, then it's all a bit kind of like it's me writing in a letter to the school saying, hey, can you do this? Or this young person has this diagnosis and I need it. So you have a doctor writing into the school saying, can you do all of this, please? And implement all of this, which we will do. Of course we will. But you're kind of like hoping the school will take the letter seriously, because of course we have no power to make the school implement that. And the school might not have the resources to implement what you're saying. So it really, my experience of kind of what works best is if there's a service embedded in the culture of the school and it's visible, that is working with not only like the internal environment, but the external agencies as well, to ensure that these young people, and it works, we get them through. We absolutely get them through, yeah.
Do you think the traditional school setup is designed to make a child with ADHD feel broken?
Yeah. Totally.
And what could they do to change that?
Oh, goodness. Again, there's a whole podcast on that one. I think... First of all, it's recognizing that school doesn't work for everybody. It just doesn't. Like the traditional methods of learning, the curriculum, the way information is taught, that only works for people who can align themselves with that environment, but also that their brain is good with learning by, say, being verbally taught. But for not everybody learns that way. You know, we all learn. I'm a very visual guy. Like if you tell me something, I might struggle to kind of like hold that. But if you show me something, I'll get it, because that's how my brain works. So it's understanding that it's not just neurodiversity; it's different modes of learning, but also that. Especially with young people with ADHD, is they thrive on praise, like lead with praise, lead with reward. We know this stuff works really, really well. But if you have a system that's designed to punish and to make the young person feel worthless, then it can't work.
And it feeds into the anger, right? Because that kid's going to get a diagnosis later in life. They're going to think back to their experience with school, and that's probably going to fill them with resentment and anger at how it wasn't spotted, how they were treated.
Yeah, very much so. I hear that all the time. Yeah. And it's too late. It's too late. Like, you're not going to go back and reset your GCSEs or A levels. Like, it's too late. But it is, and and a lot, like I was saying earlier, a lot of those memories they're deeply unpleasant. And also, like, it's a real kind of sadness of, well, I could have had it a bit easier, actually. Yeah, it just could have been a bit more nicer for me. Yeah.
Lots of people who listen to this podcast are late diagnosed ADHDers, filled with that shame, the anger that you're discussing. Do you have any closing advice, any closing words for that person listening who has gone their whole life feeling different? They've just got a diagnosis. They're now in the pits of that anger. Do you have any advice for that person right now?
Just be careful with the anger, because anger is, again, it's one of those ones that's hardwired into the brain. So we're born with that. And anger is not necessarily a negative emotion, because it can be hugely helpful in understanding when something's gone wrong or we've been the victim of injustice or something like that. So it's kind of that idea of righteous anger. But the difficulty with anger is whether it's anger because something's gone wrong, or if it's justified anger. It holds a lot of energy, and it hyper arouses the body, and it pumps very powerful chemicals of adrenaline and cortisol through your body. And when that anger is present, as in the energy is present, then that can become destructive. And that can become a problem for that person then to be able to manage their anger. So if you're struggling with the anger, first of all, your anger is justified. It's valid. It absolutely is valid. But you need to be very careful what you're going to do with your anger now, and make sure you're dealing with your anger in healthy ways. So healthy ways being exercise, sport, go to therapy if you have to. But just that the anger is not going to actually cause additional harm, because the person's gone through enough harm already, and we don't want the anger causing unnecessary additional harm to that person.
Yeah, it's great. I'm just thinking of some of the people I know who have gone their whole life, they get their diagnosis and they experience that feeling of anger, it's grief, sadness and anger bottled into one. And it's a process. They go through the stages.
Yeah.
They hear the words, you have ADHD. And for a moment, they might be thinking, well, I knew I had that. It's not a surprise, but then it kind of sets in over weeks or months or even years. And then they suddenly have flashbacks to that time at school or that relationship, that argument they had with their boss. And the rage really boils up.
Yeah. Anger, it can be a primary or secondary emotion. So sometimes what we think is anger, because it feels like anger, isn't anger. It can be a secondary emotion, but the primary emotion we're feeling is disappointment, frustration, agitation, guilt, shame, sadness, grief, any number of things. So that's the true feeling. That's the primary emotion. But what we think we're feeling is anger, but it's not always anger.
So can it imitate other emotions, or are you confusing it with them?
You're confusing it, because it's the feeling. So it's the physiological feeling. Like, I'm angry. Well, but are you angry? Let's break it down. Like, are you disappointed? Are you frustrated? Do you feel like somebody's let you down? Are you sad? So people confuse the feeling of thinking, well, that feels like anger because they feel hyper aroused. But actually what they're really feeling is a different feeling, which is why when people get very angry, they can start crying, because you wouldn't expect an angry person to suddenly burst into tears. But actually, it's not anger. It's probably sadness.
And is it possible to identify the different emotions?
Yeah, so that's the work you do with me. Yeah. We would help you work on all of that to understand what's actually happening. Yeah. Yeah.
If someone wants to identify a particular emotion, what's the first step?
So you've really got to be reflective with this one, Alex. So it's about like generating that self-awareness of your life story, the triggers, the things that are happening in the moment, maybe the thoughts or the memories that were around, and then identifying then the subsequent feeling that came about as a result of that. So you got to generate the awareness first before you can start to understand, okay, what's happening here? Yeah. So that, I suppose you can do that yourself, but I suppose to really kind of do that piece, go to therapy.
Amazing advice. Thank you, Dr. Mark, for your time today. Thanks for answering the washing machine of woes so gracefully.
Pleasure.
Thank you for your time.
Pleasure. Thank you for having me. I really enjoyed it.